Could that persistent heartburn, bloating after meals, or feeling full too quickly just be getting older? Or are they whispers that something far more serious might be silently happening inside you? Millions of people worldwide experience these discomforts daily, but most ignore them, blaming stress, poor diet, or common digestive issues, never imagining these could be the first murmurs of an invisible, cunning, and lethal enemy, stomach cancer. What if I told you the most dangerous symptoms of this cancer aren't the ones you expect, but rather subtle, treacherous signs that disguise themselves in your daily life, going unnoticed until it's too late? Stay with me for the next few minutes, because what I'm about to reveal could change your perspective on your health and perhaps even save your life by uncovering the 8 unexpected stomach cancer symptoms you should never ignore. The story of stomach cancer is often a narrative of silence and disguise. It doesn't arrive with alarms, but with minor discomforts that become part of the landscape, confusing themselves with everyday ailments. Imagine your stomach as a vital fortress, the center of your digestive universe, tirelessly working to extract life from food. Now picture a silent invader growing within that fortress, slowly eroding its walls without you realizing the extent of the damage. Often, by the time the more obvious symptoms like intense pain and drastic weight loss finally appear, the disease has already advanced, making treatment more challenging. But what if I told you there are warning signs much earlier than that, clues left by your own body that, if deciphered in time, could be the key to your cure? The first of these unexpected and perhaps most insidious signs is a persistent feeling of early satiety, even after consuming only small amounts of food. Think about it. You've barely started eating and you already feel completely full, as if you've devoured a feast, when in reality you've barely touched the food. This sensation, medically known as early satiety, is a subtle warning that something might be obstructing or stiffening your stomach walls, preventing it from expanding normally or emptying efficiently. It's not just eating less or being on a diet, but rather a physical inability to consume enough. How many times have you attributed this to a heavy lunch or simply not being hungry? But what if the truth was deeper, more concerning? Next, we have progressive difficulty swallowing, a symptom doctors call dysphagia. At first, it might just be a slight discomfort when swallowing solid foods like meat or bread. Over time, the difficulty intensifies, extending to softer foods and, in more advanced cases, even to liquids. Many people ignore this sign, thinking it's just a lingering cold or an irritated throat. However, the stomach is directly connected to the esophagus, and a tumor growing in the upper part of the stomach can compress the esophagus, making it difficult for food to pass. It's a situation where nature is trying to tell you something very clearly, but we, in our busy routines, prefer not to listen. Have you ever felt a strange choking sensation that lasted longer than usual? The third treacherous symptom is a persistent and unexplained feeling of abdominal bloating, which doesn't improve with gas relief or dietary changes. Imagine your abdomen looking swollen, as if you're pregnant or have just eaten too much, even when that's not the case. This bloating, often accompanied by a feeling of fullness and discomfort, can indicate fluid accumulation in the abdominal cavity, ascites, resulting from the spread of cancer to the peritoneum, or even the tumor itself taking up space. It's a bloat that doesn't go away, that becomes a constant companion, and that many confuse with gas or constipation. But when your body bloats for no apparent reason, it's not a sign that it's just reacting badly to something, it's a warning sign. Have you ever felt this stubborn, bloated belly that just won't go away? Continuing our list of silent alarms, the fourth symptom is chronic heartburn or indigestion that doesn't respond to usual treatments. We all experience heartburn occasionally, especially after a heavy or spicy meal. Antacids usually solve the problem quickly. However, if you're experiencing constant heartburn that worsens over time and doesn't improve with over-the-counter medications, this could be a sign of something more serious. A stomach tumor can interfere with acid production, gastric motility, or even block the stomach outlet, leading to constant and severe reflux. Don't underestimate persistent heartburn. It could be your body crying for help. How many times have you resigned yourself to living with the discomfort of a burning sensation that never goes away? The fifth symptom, often invisible to the naked eye, is unexplained anemia. If you constantly feel tired, low on energy, with pale skin and mucous membranes, and your blood tests reveal a low red blood cell count without an apparent cause, this could be a sign of slow, continuous bleeding in the stomach caused by the tumor. This bleeding, being gradual, isn't noticeable in stool or vomit initially, but it drains your vitality day after day. Anemia is a silent thief of energy. And if there's no clear explanation for it, your stomach should be investigated. Do you feel more tired than usual, even after a good night's sleep? Perhaps it's time to check for something deeper. I'd like to ask a small favor that makes a big difference. If this content is helpful to you, if it's raising an alarm or providing important information, please consider liking this video. And if you value health information based on science and explained in a clear, uncomplicated way, I invite you to subscribe so you don't miss future videos. Every interaction from you helps us get this message out to more people. The sixth warning sign, and one of the most frightening, is unintentional and unexplained weight loss. We're not talking about losing a few pounds because you're dieting or exercising more. We're talking about pounds that disappear from your body without you doing anything to make it happen. This weight loss can be due to difficulty eating, poor nutrient absorption caused by the tumor, or the accelerated metabolism of the cancer itself, which consumes your body's energy. If you're losing weight mysteriously and rapidly without a logical explanation, it's a red flag that requires immediate attention. Have you recently weighed yourself and noticed an unexpected drop in numbers without making any effort? Seventh, we have dark, tarry stools or vomiting blood. While these are more advanced symptoms, it's crucial to be aware of them. Very dark, strong-smelling stools, melena, indicate the presence of digested blood, suggesting bleeding in the upper gastrointestinal tract, including the stomach. Vomiting fresh blood or coffee ground-like material, also clear signs of hemorrhage. These symptoms cannot, under any circumstances, be ignored, as they indicate a medical emergency. Have you ever experienced something like this and thought it was just something you ate? And finally, the eighth unexpected but no less important symptom is persistent abdominal pain and a constant discomfort in the upper abdomen that doesn't relieve. Unlike the acute pain of gastritis or an ulcer, this pain can be more vague, a sensation of pressure, heaviness, or burning that doesn't go away, even after using common antacids or painkillers. It can be pain that radiates to the back, a feeling that something isn't right in that area. It's a pain that settles in and becomes a constant companion and which over time can intensify. Pain is a warning from your body, a silent scream that deserves to be heard. Have you been living with pain or discomfort that has become part of your routine? It's crucial to understand that the presence of one or more of these symptoms does not necessarily mean you have stomach cancer. Many other benign conditions can cause similar symptoms. However, the persistence of these signs, especially if they appear in combination or in people with risk factors, such as a family history of gastric cancer, H. pylori infection, smoking, excessive alcohol consumption, and a diet rich in processed and smoked foods, should raise an alert and prompt an urgent visit to the doctor. Early diagnosis is key to successful treatment and in many cases to a cure. Don't wait for the pain to become unbearable or the weight loss to become visible to seek help. The diagnosis of stomach cancer usually involves a series of tests. The first step is a detailed medical consultation, where the healthcare professional will collect your history and perform a physical exam. Then they may order blood tests to check for anemia or other markers. The most crucial test for diagnosis is an upper endoscopy, a procedure where a thin, flexible tube with a camera at the end is inserted through the mouth to visualize the esophagus, stomach, and duodenum. During the endoscopy, the doctor can perform biopsies, which are small tissue samples taken for laboratory analysis, confirming or ruling out the presence of cancerous cells. In addition to endoscopy, imaging exams such as computed tomography, CT scan, and magnetic resonance imaging, MRI, can be used to assess the extent of the tumor and whether it has spread to other organs. Once stomach cancer is confirmed, treatment is carefully planned based on the stage of the disease, the tumor's location, and the patient's overall health. Conventional treatment often involves a combination of approaches. Surgery is the primary form of treatment for most cases of stomach cancer, especially when the disease is localized. Depending on the tumor's size and location, part or all of the stomach may be removed, partial or total gastrectomy. Chemotherapy and radiotherapy are frequently used before or after surgery to shrink the tumor, eliminate remaining cancer cells, or control symptoms in advanced cases. More recently, targeted therapy and immunotherapy have emerged as promising options, targeting specific characteristics of cancer cells or stimulating the patient's own immune system to fight cancer. Most importantly, discuss all options with your medical team and build a personalized treatment plan. It's understandable that such a diagnosis can be overwhelming, but it's crucial to maintain hope and seek appropriate treatment as quickly as possible. Remember, early detection is your greatest ally. Every minute you spend worrying without acting is a minute lost. If you identified with any of these symptoms, if your body has been sending you signals that you've ignored, don't wait any longer. Acting now can make all the difference. I sincerely hope this video has been a valuable source of information and a catalyst for you to pay more attention to your own body's signals. Your health is your most precious asset, and no one can take care of it better than you. If this message resonated with you, if it brought you clarity or raised an alarm, please like this video so that more people can access this vital information. And if you want to continue receiving content that can transform your life and your health, subscribe to the channel and hit the bell icon so you don't miss any updates. I invite you to share in the comments which of these symptoms surprised you the most or which one you've experienced. And if you feel comfortable, share your story. Your experience can inspire and help others. And most importantly, share this video with your friends, family, and everyone you love. Share it on WhatsApp, social media, by email. You might not know it, but by sharing, you could be saving a life. Small signs, when ignored, can lead to big problems. Big hug and take care.